Hi, today I wanted to talk about OCD, obsessive compulsive disorder. I'm Yashasvi, I'm a clinical psychologist. So, as we all know, that go-to treatment for OCD is ERP, but I also wanted to request everyone to keep in mind the underlying dynamics of obsessive compulsive disorder. So, as we all know, and it is a common knowledge that people with OCD have perfectionistic tendencies. They want everything to be perfect. Any experience of any emotions or feeling is felt as something is going out of control. It is shameful, it is embarrassing. And even people who have contamination fears, even going to the toilet is a big task. So it is almost like it is unacceptable to have a body which can shit, which has fluids coming out of it. And there is this almost strive towards to get a almost like a perfect body, perfect, to be a perfect person, which doesn't even have excretory functions to it. So I wanted everyone to keep in mind that people with OCD suffer great deprivation in areas which involves play, fantasy world, sexuality, romantic relationships, friendships, anything which brings out the sense of aliveness in a person. And those areas are very, very stunted, almost like any entrance into the sexual world is also greatly resisted in any fashion. And I had a patient who would keep studying mathematics. There was never any mention of geography, literature, or history, which can involve landscapes, stories, and histories. So, almost like anything which brings out a sense of aliveness needs to be run away from. And so they are not really living a life, a full life, and it is almost like being dead in a way. And so they are not really alive, they are not really actually dead. It's there is metaphorical deadness which is there, and this is the paradoxical situation which a clinician is required to help them to come out of with long term therapy. And which Freud also calls something where helping the patient move from anal stage to oedipal stage, which involves some fantasies, some sexuality. And yeah, so this is, and when we start imagining a patient like this, we actually start seeing them as